The sensation of a blocked nose is often referred to as nasal obstruction, a stuffy nose and nasal congestion. The severity of the nasal obstruction varies from one patient to the next. Some people find even mild nasal blockage quite troublesome, whereas others, with quite severe nasal obstruction, find it does not have a significant impact on their day. Your specialist will take this into account when developing a plan for your treatment. Nasal obstruction is a symptom in itself. In certain conditions it may be accompanied by other symptoms such as rhinorrhea, facial pain, anosmia, loss of sense of smell, sneezing, itching and your specialist will consider these other symptoms when making a diagnosis and developing a plan for your treatment. Mild nasal obstruction may not require any treatment. If your symptoms are short-lived, lasting only a few days to a couple of weeks, you may want to treat it yourself using over-the-counter medication such as a decongestant. Decongestant sprays should not be used in the long term. Sometimes people find it soothing to breathe in steam, or vapors such as menthol and eucalyptus. Saline drops or sprays, or other nasal douching preparations from your pharmacist may also be used to help wash away any thick sticky mucus. If your symptoms are caused by a seasonal allergy and are mild and intermittent, an antihistamine tablet may help. Alternatively, your GP may prescribe a steroid nasal spray. It is important to follow the instructions provided with this treatment. If the cause of your nasal obstruction is collapse of the outside of the nasal tip, you may find it useful to wear an adhesive dilating strip, particularly at. The first thing your specialist will do to diagnose your condition is ask some questions about your symptoms. Asking about your symptoms is very important to help narrow down the possible causes of your condition. Treatment options for your blocked nose depend on the underlying cause and severity of your symptoms. They include medication and. If the cause of your nasal obstruction is rhinitis, your specialist may prescribe a course of medication such as an intranasal steroid spray, antihistamines or. It is important to follow your specialist's instructions closely. In some cases it is necessary to take the medication for several weeks before you will see any improvement in. If the cause of your nasal obstruction cannot be treated by, or does not respond to medication, your specialist may recommend an operation. The type of operation performed depends on the underlying cause of your blocked nose. Operations include septoplasty to straighten the nasal septum, rhinoplasty to straighten the outside of the nose, and turbinate surgery to reduce the swollen folds of mucus. Blockage caused by persistent or recurrent infection in the sinuses may be relieved by sinus surgery. Adenoidectomy, surgical removal of the adenoids, can be performed for enlarged adenoids, and polyps may be removed independently or as part of other. It is important to remember that there are a large number of possible operations to relieve nasal obstruction. Each surgeon will favor the operation they feel works best in their hands for your particular condition. To help clarify the cause of your symptoms, your specialist will then examine your nose, often with the help of a headlight or an endoscope, a thin telescope with. This examination is not painful, but some people find it slightly uncomfortable. Occasionally your doctor may want to do some other tests to help clarify the cause of your symptom. Common tests include blood tests, skin tests for allergy, and imaging studies such as a CT scan of the nose and sinuses. It is important to remember that not all conditions causing nasal obstruction need investigation. Your specialist will decide which investigations are necessary.